Welcome to another episode of Go Fort Smith, sponsored by J. Pauley Toyota. I'm your host, Sydney Brooks. Today we will visit with members of the Sebastian County Opiate Drug Task Force to see how they are making a positive difference in our community. Then we will talk to our philosophical farmer, Clyde Fenton, about how to grow those delicious herbs and vegetables in your own backyard. Lastly, we will explore all the fun facts at the Evel Knievel Museum in Topeka, Kansas. Several local organizations have joined forces to tackle the misuse of opioids in our community. The Sebastian County Opiate Drug Task Force was formed to bring awareness to individuals, families, and neighborhoods, and more importantly, to save lives.
In 2017, I think several people that are involved in the community, former Sheriff Hollenbeck and some of the medical professionals and mental health professionals were talking, and they were talking about the increase that they were having both with substance abuse issues, overdoses, and deaths, and they were talking and they thought this was something that they could do to promote awareness and education in the community. So after getting together, I believe they got with Mercy, and they agreed to host it, and then several disciplines came together and started with the meetings and discussing what they could do and how they could do it to improve these things in our community.
Well, we've got a lot of different arms as far as areas where we're trying to work on. The 30,000-foot view is we want to reduce deaths and reduce all-cause harm to the community and the individuals affected. You can get down a lot deeper into that. You can look at the, we want to reduce recidivism. We want to keep people that have had problems from going back to prison. We want to, so we want to help our repeat victims, and I call them victims because they're victims of their addiction at this point. We want to prevent things. We want to stop it before it starts, because that's so much easier than dealing with the overdose or dealing with the addiction down the line as far as long-term addiction treatment. So. We want to reunite families. We want to keep families that are fractured from these addiction issues and their entanglements with law enforcement. We want to get them back whole again, because that's, again, these social issues contribute to addiction issues and addiction liability as well. Families that are whole, the children do better, and we just know that.
I mean, what we're looking at is a collaborative effort, a multidisciplinary task force, and trying to bring people together that all had a vested interest and a stake in this issue. So we've worked with numerous other state agencies, Drug Task Force, DHS. Here locally, we work with the Drug Task Force, we work with mental health professionals, we work with educators, we work with education and treatment facilities. So basically it brought everyone together, and the message was primarily initially education, and then what can we do to bring those numbers down. We know that nationwide we're seeing those same issues, so we thought it would be prudent to get together this organization and start trying to get our message out. And so we've hosted two summits here in Fort Smith, both in 2018 and 2019. We had one scheduled for this year, but with COVID and everything else going on, we felt it would not be safe, so we've had to put that off. And when we have those summits, we've had several hundred people that have attended them both, and so the objective is to get the word out and educate people.
We have had an increase in both opioid utilization and addiction issues that we've had to deal with both in the hospital and in the outpatient setting. This includes things like newborn babies being born to mothers who are using opioids, and they end up in the hospital sometimes weeks at a time as we withdraw them slowly. So this has been a a crisis for us, especially for mother baby care, for a while now. I am the Sebastian County Health Officer. I'm a family physician. I work for UAMS as a professor of family and community medicine, and I also am Vice Chief of Staff for Baptist. And so I've got a lot of hats I wear, but all of them are touched by the opioid crisis. As Sheriff Runyon was mentioning, we did not realize that we were one of the first in the state to be running a task force like this that was community-based and community-driven with local leaders. And we were surprised when we actually got the invitation to come and speak to the Arkansas Hospital Association about starting their own programs for these various counties in the state. And we thought we were behind in the state. And we were behind in getting our arms around the problem, but we were not behind as far as the rest of the state was concerned. And our programs being looked at as a model for other counties looking to start task forces to try and deal with their own opioid issues in their counties.
I think that the primary message is the possibility, the possible dangers of the opioids. What is acceptable use, what is not acceptable use, and let them know in these different communities that there are resources available, that we want to help them. You know, from the law enforcement standpoint, we think that if somebody's identified as having a substance abuse issue, we would much rather get them treatment and education at that point than at the time it becomes a law enforcement issue. So it's almost preventive maintenance, if you will, and that's what we're trying to, the message we're trying to get out to the community.